Hey there, VCE HHD students. My name's Andy. I'm a VCE Health and Human Development teacher. In this short video, we're going to look at improvements in Australia's health status since 1900 in Unit 3, Area Study 2, VCE HHD. Before we dive into this video, just a reminder, there's a range of different ways to engage with the Health Resources Hub. We've got our YouTube channel where there's over 150 content videos, SAC and exam tips, and new videos will be coming out each week during the school term this year. If you're on YouTube, you can subscribe with the button in the bottom corner of the video there, or just head to YouTube and search for the Health Resources Hub. We've got our website, the hrh.net.au, where there's opportunities for teachers and students. And if you're a Unit 3 and 4 student, we've got a free student newsletter coming out twice a term this year. So if you head to our website and scroll to the bottom of the page, you'll see there's a registration form you can fill in there. We've also got our social media links there. You can follow us and get alerts to our new videos and other opportunities, and also our email if you'd like to get in touch. So this video is focusing on Australia's health status since 1900 and how that has improved. And so obviously when we're talking about health status, we're talking about terms such as life expectancy, mortality and morbidity. And you would have covered those in Unit 3 Area Study 1, but this is the first key knowledge point in Unit 3 Area Study 2. So a couple of things to take note of. In the first point there, it mentions that in the early 1900s, infectious diseases were much more prevalent than they are today. And we'll talk about this a bit more in our upcoming video on the old public health, but a couple of examples of those are tuberculosis and diarrhea. And so when we're talking about infectious diseases, we're typically talking about conditions caused by bacteria or viruses that can be spread from one individual to another. However, across the 1900s, there was an increase in the prevalence of lifestyle diseases and a decrease in the prevalence of infectious diseases. And those lifestyle diseases are conditions associated with behaviors such as smoking and a poor diet. And they're examples such as lung cancer and cardiovascular disease, which we've probably chatted about across Area Study 1 this year already. So then you can see I've included a few examples of changes in health status since 1900. So you should know some off the top of your head, although a question might start with a graph or a table which includes some of this information and asks you to identify one of those changes. But you can see there an increase in life expectancy for males and females, a decrease in the under 5 mortality rate are a couple of examples, followed by a couple of examples about conditions that were typically communicable or infectious, so a decrease in the prevalence of infectious diseases and a decrease in the prevalence of respiratory diseases. So tuberculosis is an example of a respiratory disease. An increase in HALES, that's health adjusted life expectancy, the number of years individuals in Australia are living in good health, and then a decrease in mortality for injury and poisoning. So there are a few that you can remember just off the top of your head. So as I mentioned, you could be given some data, and asked to identify perhaps some of these changes in Australia's health status since 1900. And so you can see here, this is quite an interesting table, that gives you the top 10 causes of death from 1907 and 2000. And so you can see the top section here is for males. If you look down that 1 to 10, you can see there's quite a number of these infectious diseases. So tuberculosis, diarrhea, and there's some of those respiratory conditions we were sort of referencing before. So once again, tuberculosis, pneumonia. Whereas if you look over here in the year 2000, a lot more of these, lifestyle associated diseases. So ischemic heart disease, cerebrovascular disease. So they're examples of cardiovascular disease, lung cancer, looking down further, some other types of cancer, diabetes, and it's very similar, for females. So thinking about some of those changes that I was talking about before, they're reflected in this data here. Also, you can see this graph here gives you an example once again for males and females from 1907 to 2003. Some examples, of the different conditions and how there's been changes in the deaths per 100,000 of the population. So the way you essentially read this here is that the width of these colored sections here represents, the number of deaths per 100,000 population for those particular conditions. So for example, as I said, early in 1907, you can see there the width for infectious diseases, is large. And then if you look now, in more recent years, you can hardly see that color for infectious disease. And that obviously represents quite a decrease in the deaths per 100,000 of the population for infectious diseases from 1907, to closer to today. And that's similar once again down here for females. Hopefully you found that useful. Just a reminder, we've got a SAC preparation session coming up for Unit 3 Area Study 2. So if you're after a 50-mark practice SAC and answer guide, you can register for one of these sessions on either April 14th or 28th. And so April 14th is the last day of the term 1 holidays, okay? And you'll receive that 50-mark practice sack the same day you register. You'll be able to complete that before the online session, and then we'll go through that during the session, as well as other common mistakes to avoid for this sack, as well as the opportunity for any questions you've got. And then after the session, you'll get sent an answer guide. Okay, thanks so much.